Hello, Medicare Advantage risk adjustment operators, innovators, and learners. Welcome to another learning series of the Hughes Academy Risk Adjustment Made Easy, the Medicare Advantage kind. If today is your first time that you are joining us, we want to say welcome to our channel. If you have been learning with us, we also want to say thank you for joining us. If you have not liked or subscribed to our channel, we encourage you to do so because it helps us to reach a wider audience and also helps you not to miss anything from us. I hope that you had a wonderful Thanksgiving for those that are in the US. Today we are picking up from where we had started last month as we covered special needs plans. We have looked at introduction to the special needs plans. We've looked at dual special needs plans. We looked at chronic condition special needs plans, and today we are looking at I-SNPs, institutional SNPs. Institutional special needs plans are specific types of special needs plans that are Medicare Advantage plans, because we are dealing with Medicare Advantage here, but it is specifically for individuals who need long-term care services, nursing facility level services. Members must need institutional level of care for 90 days or longer, and the I-SNPs serve residents in skilled nursing facilities, intermediate care facility, or individuals with intellectual disabilities or inpatient psychiatry facilities. And it can also serve people who are living at home but require institutional level of care. So this is a special Medicare Advantage plan that is set up for this population specifically to enroll in and to have such a level of care that is coordinated in that fashion for their specific needs. I-SNPs work this way, and this is a high level summary because that's what we've been doing throughout our videos. For facility residents, I-SNPs must own, operate, and contract with long-term care facility, which is the health plan contracting with them. Facility must follow the I-SNP CMS approved model of care, and I-SNP's clinical staff must have access to members in the facility. So these are things that are needed from the plan perspective as it works with providers. For community members, institutional equivalent, I-SNPs must use state assessments tool to determine institutional level of care, and assessment must be done by independent party, not the I-SNP of itself. And the members must qualify for institutional level of care to enroll based on the assessment that is needed. And if members move, I-SNP must be ready to implement the model of care at the new location. So these are some of the things that are needed for I-SNPs from a plan perspective as the plan works with their provider. And from a risk adjustment perspective, with this population being the membership of the health plan, then the risk scores are fairly at a higher level. If you have an I-SNP health plan and your risk score is not at a higher level, then there's something going wrong that you need to look into. And also it flows through where data is coming from that then feeds into your risk adjustment submissions and ultimately to your risk score. So knowing the population you deal with then helps find some validation areas in terms of where you can look at risk score and where some things may be leaking as you submit accurate risk adjustment data to CMS. That feeds into your risk adjustment payment. Looking at the growth of I-SNPs, just like we've been doing for the rest of them, and this data is also coming from Mimi Labs, as I've been talking about. Mimi Labs is a platform with a community that is aggregating publicly available healthcare data in one place where you can easily query the data. So if you're in healthcare, want to learn about Mimi Labs, you can go to mimilabs.ai, and we have the Mimi bot that you can leverage that in terms of analyzing the data. It's really cool. So you want to test it out. But coming to the growth of I-SNPs. So I-SNPs, looking at the plans and the number of contracts, you can see that the I-SNPs numbers have been going down relative to the other two that we learned of last time. Actually going through the comparison and looking at the growth, the I versus the C versus the D SNPs, you will see that D SNPs is all high here, looking at the plans versus the number of contracts. And you can see C-SNP is increasing, but the I-SNPs are going down from that perspective. And that is what we have for today. As we've covered the SNPs and the various types of SNPs and how each one of them has been growing over time, and seeing where companies are shifting contracts and plans depending on the number of offerings and plans and contracts that are in this space of the special needs plans. If you are not on our email list, I will encourage you to go to our website www.thehealsacademy.com and get into the risk adjustment section. You will get the privilege to be part of our email list, and you get the chance to get our signature gift, From Chaos to Clarity, the essential comparison cheat sheet on Medicare Advantage risk adjustment data sources that compares Medicare Advantage data sources for you for free. And otherwise, we will catch you next week as we wrap up the rest of the year on special needs plans. Thank you so much, and bye for now.